Okay, thank you all for joining again. This is the Indicator 12 compliance training for today, and in the chat is the attendance link. Please log in and complete your attendance and introduce the team once again so that anyone that just popped in would know. I'm Heather Anderson, the director of the APR support team, and we have Sherry Walker from West Tennessee, Dolly from Middle Tennessee, and Colleen from East Tennessee. Okay, let's get started then on our compliance training. Next slide, please. All right, just wanted to let you know that the work of this team, the APR support team, and this presentation aligns with the department's Best for All priorities for equipping Tennessee districts and schools to ensure that all students have access to a high-quality education. And our focus is on increasing those outcomes for our most vulnerable population, those students with disabilities. Next slide. All right, for our agenda today, we're going to be providing training and guidance for LEAs and early childhood staff to ensure compliance with Indicator 12, to try to clear up all those questions that were presented to us at SPED Institute. We've compiled all of those and have developed a new Indicator 12 FAQ, 10 or 11 pages filled with a lot of your questions that you have brought forward. Some research done on those, and that is in final review right now. Will be posted on the Early Childhood Special Education webpage in the coming days, and we'll be able to link. In addition, this webinar will be posted on the webpage in the coming weeks as well for you to review back to. Let us know if you have any questions about that. The training is going to be interactive today. We will be using Mentimeter. So if you're familiar with that, if you would use your phone and go ahead and log into menti.com or go ahead and Google that. And when the time comes for that, we will give you a number to, oh, there it is right there. She's got it up. So you'll see using that code 3836-7546, and that will allow you to participate in some of our interactive polls and some things that we have. So, okay, Sherry's going to start us off with a fun little Wordle as we get going today. Sherry?
Okay, if I believe Dolly or Colleen is putting menti.com in the chat, menti.com. Some of us are used to using this web page, and the code is 3836-7546. So if you type menti.com in your phone, if you have that available, put the code in. Our statement today is the transition to preschool is sometimes blank for children and families. Oh my goodness, it's overwhelming. It's difficult. Confusing.
Scary.
Can be.
Intimidating, stressful, daunting, there you go, misunderstood, very good, sad, complex. Yes, it is.
It is complex.
Not equitable.
That's interesting.
Yes. So the transition to preschool is sometimes what for children and families? Rewarding. There you go.
There's a good positive word.
Any other thoughts? Relieving, wonderful. Intimidating. Is that a jump? Exciting.
Exciting, yeah.
All right, well, thank you so much. Those are wonderful statements, probably from your perspective, but thank you so much for participating with us.
So it can be very daunting, overwhelming. Let's go on to some indicator definitions. So we're going to talk a little bit first before we get into some of the scenarios to really help explain some of these questions, some things that haven't been maybe clear enough for you. So we're going to talk about the reporting and the compliance pieces first and why we have to do this, why we do what we do. So our next slide is the next two slides are going to be just a few indicator 12 definitions that I know all of you are well aware of, but just wanted to point out what those are. And so what transition is, referring to those events and processes that are in place for eligible children as they move from the Part C early intervention over to us Part B school system services. And indicator 12 is a compliance measure for any children referred by Part C prior to age 3 who are found eligible for Part B and who have an IEP developed by the 3rd birthday. So OSEP, Office of Special Education Programs, Department of Education, who we federally report to. Next slide gives us just a few more definitions of our counter partners who we work with in this initiative is the Tennessee Early Intervention System, known as TEIS. That's the Part C program for birth to 3-year-olds with disabilities and other delays. The Tennessee Early Intervention Data System, the TEADS program, is a data system for tracking those Tennessee children birth to 3 who receive those early intervention services as they progress through Part C. And then, of course, what you're most familiar with as we are at the state is the Easy IEP data system. It's our statewide software managed by the department that we use to collect, store, and manage that data collection for all those students with disabilities ages 3 through 21. Okay, so APR reporting, the why we have to do this. The whys are that both the LEAs and the states are statutorily required to collect and submit transition data to the federal government each year. So OSEP does require that. It requires that each district, along with the state, develop those performance plans and that those evaluate the state's efforts to then implement IDEA. So we are partners in this. We must ensure that all of the requirements for our students and our children with disabilities are met through the IDEA. So we're partners again, but the plan includes baseline data, measurable, rigorous targets, and a plan for refinement for any of the APR data indicators. And it is a compliance indicator, meaning that it is 100% compliance. Some of the other indicators you're aware of will have lower percentages and targets. However, indicator 12 is one of those compliance indicators, and OSEP does expect that all states will ensure that the LEAs follow all procedures and meet timelines for 100% of those precious children who transition from Part C over to Part B to us. Okay, so OSEP does recognize that there are many reasons that referred children may not have an IEP in place by the 3rd birthday, and they do allow the following exceptions when the department is making those indicator 12 determinations. So I just wanted to kind of highlight here what those exemptions from OSEP are and are not. First of all, children that are not determined eligible due to withdrawal of consent. So those parents who have decided we no longer want those services, or the child has moved to a different area. Children that do not meet the timeline because the parent failed or refused to make the child available. That is most of the time what those that's a parent reason, and most of the time what we find in our determinations. The children for whom the parent refused to provide consent caused delays in evaluating. That is a very big one. They may want the services, but they just repeatedly refuse to provide the child to you to pursue the evaluations. Also, children who were referred to Part C, meaning children who were referred to TEIS less than 90 days before they turn 3. And then the last one, that they're determined to be non-eligible. And that eligibility was determined prior to the 3rd birthday. So keeping in mind, these are the exemptions. Any other reason for the development and implementation of a late IEP will result in a finding of noncompliance. Those are the only exemptions that OSEP allows the department or the LEAs. Next slide, please. So how does the department determine indicator 12 compliance? I know we received this question a lot, either internally through emails or through the SPED Institute. I know this question was brought up. So what exactly goes into how this is determined? And again, it's working together many months in the year prior to the reporting, and then in the months after to make sure that those children are resolved for. But the department is federally required to annually report to OSEP every February, by February 1 for indicator 12. And the process includes the following. So TEADS data is requested from Teis. So Zach, some of you are familiar with Zach Stone and our data team here at the department. They will request the data to be pulled from TIS. Again, we do not have TEADS access. There was a time that the department did. We do not have access to any of those records, so we cannot see any of that data, as you can't. Only they can, but we asked for that data to be pulled, and Zach's team does the initial analysis and the assignment of preliminary determinations. So those, of course, are those categories of timely, non-eligible, apparent refusal, apparent reason, late referral, or that it is untimely. So those are preliminary determinations that are made, and those are then shared with you as LEAs. And then your response to us is that you will submit responses and supporting documentation for each of those determinations. When we receive those back, we will analyze those responses at the department to assign a final compliance determination, and many teams are part of that determination process. At the end of that determination process, once those are made, the department then provides technical assistance, and we do that along the way, during, and then after, to ensure that all of the resolutions for those children of noncompliance are resolved. And so documentation is key in that. This is just a high-level overview again of what I've just explained, just showing you the process of how that happens. So the TEADS, again, that data is gotten from TIS, and it is merged with our Easy IEP data that you all enter. And then whatever is missing from there, those preliminary noncompliance determinations are calculated and sent to you. And then you are then given an opportunity to review your data, work with us for support, to submit your responses if you need some support in finding that evidence, have to reach out to TIS. Those are then sent on to us, and then those final noncompliance determinations are assigned. Just wanted to point out what information is needed from the LEA in a response to a preliminary untimely determination. So if you receive a list from us, as you have, receive a list that there are some children that they're not accounted for. We haven't been able to resolve for them. They don't have a wrap up with a bow for their resolution. So the department sends a spreadsheet listing all the children who appear to have had an untimely transition. We all know that there are many that had one. The documentation is just not there. So the LEA must then provide a written response that includes the following. So you will include a detailed accounting of each child's transition status, whether it's resolved, whether it was non-eligible. You will need just a short write-up for each child, contact log information, and any supporting documentation that supports that you resolved for this child. Just remembering that documentation should be concise, but it should be sufficient. And in most cases, just a written explanation with dates from your contact log and Easy IEP is okay. If the evidence is in Easy, which it should be and hopefully is, please just include the child's state ID number in that information back to us, and that brief explanation as to how that was resolved. So what happens if corrective actions are required? So if your LEA has a finding of indicator 12 noncompliance, here is the next steps for you and for us to work together as partners to make sure that all of these are completed. So it is the responsibility of both the state and the LEAs to ensure that resolution of all children's records that were determined to be out of compliance. So anyone that is, any child that has not been resolved for, it is our job together to ensure that we are able to bring that resolution, have that documented proof that those children are all identified as either eligible or non-eligible, and that we have that documentation to support it. Anyone with noncompliance must complete a training, which is here today, personnel involved in that early childhood transition process. Anyone involved in ensuring that these children are moved from Part C to Part B in a timely manner. So develop and receive department approval for your early childhood transition procedures, which has all been completed during the LEA planning process. And also to demonstrate that indicator 12 compliance in the current school year, Department data review, the data team does polls. You as LEAs, I know, pull your own data to ensure that you're meeting those milestones and using your data to inform your practices so that best outcomes then come from that. Next slide, please. All right, we're going to move on again to our next section, TEIS monthly notification.
Thank you, Heather. Let's review our TEIS monthly notification. So we're all aware that all children served by TEIS are considered potentially eligible for Part B services. The monthly notification from TEIS with parental consent is sent to each special education supervisor or designee of each LEA. And that notification includes name, date of birth, and parent contact information for all children 27 months or older who are currently receiving TEIS services. So what is your response? The LEA response is to provide the parent with the notice of procedural safeguards and an introductory letter. And secondly, maintain all documentation of these actions. We have a scenario addressing TEIS notification error. I'm a new supervisor and just received a TEIS monthly notification list. One child on the spreadsheet is not zoned for my LEA. So what is my responsibility? Well, first, you're going to notify TEIS of the error. And then you're going to send the notice of procedural safeguards and a letter to inform the parent that they are not the correct LEA and that TEIS will send the notification to the correct LEA. So once TEIS has notified the correct LEA, so then what's your responsibility? It is to send the child's parent another copy of the notice of procedural safeguards and a letter explaining that they are the correct LEA and offer to convene an eligibility meeting.
All right, I'm going to take over. We're next going to talk about Transition Planning Conference, or the TPC. And this is the next big event for the transition process, the early childhood transition process. So first, I want to just review what are the LEA's requirements at a TPC. And we just talked about in our Wordle how intimidating, complex, scary, confusing the TPC, the transition process overall can be for parents and families. So we want the TPC to get us off on the right foot and to have the transition process be rewarding. That was another word that was used. So the first thing to know is that the TPC is an TEIS meeting. They have an APR indicator requiring them to have the TPC. But the LEA must participate in the meeting. And this is, like I said, your first big opportunity to make a good impression on the family and to start building a relationship with that family that may last for several years. So the LEA, as you know, needs to provide an overview of the programs and services and options that the LEA has to offer young children. Now, this, as you know, is not a meeting to determine eligibility or determine services or placement, but parents need and are going to want kind of an overview of what might be available for their child. Of course, you need to explain the eligibility and IEP processes to the family so they know what are the next steps for my child. What is going to happen in this process of determining eligibility and receiving services if eligible. And lastly, this is your opportunity to establish a means of communication and collaboration with the parent. So as you know, you want to make sure that the parent has a contact person with the LEA that they can contact as they have questions after the meeting and as they move forward through the transition process. Next slide, please. So we're going to start with a child find scenario. In this scenario, Sally Davis was on the March notification list, And we sent the procedural notice of procedural safeguards and an introductory letter to the child's parent. But now Sally is nearing her 3rd birthday and our LEA has not been asked to attend a TPC meeting. So our poll question is, have we met our child find responsibility? And this is going to come up as a poll. So yes, we've met it, or no, we haven't met it. Okay, we're fluctuating between yes and no's. I think we've about got everybody. Oh, it's changing. People are changing their minds. Okay, we've about got everybody, and it looks like most people are saying no, you have not met your child find responsibility. Although many are saying yes. This is kind of a trick question because the answer is really maybe. Maybe you've met your transition, requirements. Okay, so if the LEA, if you have documented that the procedural safeguards and introductory letter have been sent to the parent, and then if you contact TEIS and consult with them and you find out that the child is no longer active with TEIS, or the parent has elected to not follow through with a LEA transition, they don't want to transition to the LEA, and perhaps TEIS has held a non-LEA transition planning meeting. If you've done all of those things, then you have met your child find responsibility. So the answer is yes, if you've done certain things. Next slide, please. So the next scenario is a child who the service coordinator has called and the parents have changed their minds and they now wish to pursue a referral to the LEA, but your calendar is full. So what should you do, and will the LEA have a finding for this child? What you need to do, even though your calendar is full, you really need to have that late TPC as soon as possible. And you may need to consider alternative methods to holding the meeting, such as Zoom, Teams, a phone call, anything anything that you can do to have that TPC as soon as possible. But you will document in the Easy IEP contact log that the TPC is late due to apparent reason, and that's really important. Then you will proceed with eligibility and IEP implementation following the 90-day timeline of 60 days to determine eligibility from consent and 30 days after that to implement the IEP. So, but it's very important that you first document that this is apparent reason that the TPC is late. So if you meet the 90-day timeline, this will count as apparent reason in terms of indicator 12 compliance. But you need to continue to document all attempts to reach the parent, because if you don't meet the 90-day timeline, the documentation that you provide will be used for the state to determine whether you have a non-compliance finding for that child for indicator 12. So it's really important to note that the TPC is late because of the parent. So what if the TPC, if it's a non-parent reason that the TPC is late? For example, your transition coordinator was out due to a family emergency. The TPC is rescheduled, but it's only 78 days before Logan's 3rd birthday. How will this impact our LEA indicator 12 data? Well, it will impact your data. A delayed TPC for a non-parent reason, such as the weather or sickness of TEIS or LEA personnel, or a scheduling difficulty that's due to the TEIS or LEA, all of those situations will be counted as untimely if the IEP is not developed and implemented by an eligible child's 3rd birthday. So when you have a late TPC for one of those reasons, you really need to meet that 3rd birthday. Next slide, please. So another thing that we found with LEAs is sometimes there's confusion between what is a late TPC versus what is a late referral. A late TPC describes a situation where the child has been receiving TEIS services. It's just that the TPC is going to be late. but the child's been receiving services. They are a TEIS child. So in that situation, you use the IEP contact log to document the reason for the late TPC. And then you pursue and provide documentation of all activities that you've taken to try to complete the transition by the 3rd birthday. And if you will respond to Indicator 12 inquiries with contact log and documentation information if it is untimely, if you don't meet that 3rd birthday. A late referral is different. A late referral describes a child whose initial referral to TEIS is less than 90 days before a child's 3rd birthday. And in that situation, that's where you receive the official LEA referral form from TEIS, and you begin the referral process with the child's parent. You would also want to contact TEIS for information on any evaluations that they have or the individualized family service plan. And this would be reported as a late referral for Indicator 12. So you can see you can have a finding for a late TPC, but for a late referral, it would be counted just as a late referral for Indicator 12. Next slide. So we've got another scenario. What if a child moves to your LEA after they've had their TPC with another LEA? So in this scenario, the TEIS service coordinator who serves our area informed me of a recent addition to her caseload. A TPC has already been held, but in another LEA. What is our responsibility? And the question is true or false. The LEA attending the TPC is responsible for Indicator 12 compliance. Is that true or false? And this is a poll question.
So I need to reset it. Sorry.
It's okay, it's showing.
Okay,
People are thinking.
it's being a little fickle.
Is everyone seeing the poll?
I don't know that they're getting,
No, I'm gonna go out
Respond.
and come in. It's not launching properly.
Okay,
I can't answer the question.
Yeah, it's okay.
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 Okay, I don't
Give
know.
us-
what
give
it's
us a
doing,
moment. We'll
but
try to
we
bring it back up.
will- We will try to reset this, relaunch. Here we go.
Okay. Now hopefully people can see and answer the question.
Popped out.
It is not wanting to.
Okay, we
cooperate.
can just do it in the chat. Let's just, okay, well, people have someone, yeah, people are
Yeah,
responding now.
it's really acting up. I apologize.
It launched.
Okay,
It was
So-
slow.
we're getting on up there towards 100%, and it looks like it's a little bit more false, but true is right in there also. So there's a debate about whether it's true or false. It's now
Right,
50-50. Yeah. So I think everybody has responded. Yes, everybody has responded. So the answer is it is true. The LEA who attends the TPC is the LEA that is responsible for Indicator 12 compliance. That is true. However, if you're the LEA who receives the child after the transition planning conference has been held with another LEA, you need to continue the transition process by completing the following. You need to, of course, send the notice of procedural safeguards and an introductory letter to the child's parent. You need to proceed with eligibility determination. And you would want to inquire about any current evaluation information that the other LEA has. And the important part is to request a transfer of the child's record in Easy IEP so that you can start using that record. But you would not be held accountable for meeting Indicator 12 compliance if you're not the LEA who attended the TPC. So next slide. So what if you are the LEA who has had the TPC and then the child moves away from your LEA before they turn 3? What do? You need to document, as we'll say throughout this presentation, document. In the Easy IEP contact log, the details of when the child moved and how you how you were notified, how you know the child moved. Then one important thing to do is to inactivate the child's record as moved known to be continuing. That's important, one, to allow the transfer of the record. And also that resolves with the relevant documentation that you have, that resolves the record. And so that would be in compliance with indicator 12 if you inactivate the record for an appropriate reason, such as the child has moved. Then you would want to, as a courtesy, communicate with the receiving district to help complete the transition process. So if the child's record has been inactivated, it would count as a parent reason for indicator 12 reporting purposes. So it's very important to inactivate the child's record when it's appropriate to do so. Next slide. I'll turn it over to Colleen.
All right. So we're going to look at some questions around determining eligibility. We've got several scenarios we'll be using in this section, and several times that we're going to ask you to interact again. So if we can go to that next slide. And in this scenario, Billy's family participated in a transition planning conference on March 10th, 2022. Billy has made progress throughout his early intervention services, and his parents do not have any concerns related to his development and education, and they do not want to pursue LEA services at this time. How should the LEA document that this transition has been completed? So as you've heard many times already this morning, you want to maintain your documentation. One of the items that may be included here is whatever your process is for note taking at a transition planning conference. That would be good information to keep. Some LEAs have developed a form for the parent to sign and date that they are going to decline having an evaluation, decline pursuing any services with the LEA at transition, after transition. This also could include using a prior written notice, which would describe some of that information we just spoke of. So one of the things that can be considered in a prior written notice is identification of a child. The LEA is not going to identify this child. Include that information that the parent is declining to have the evaluation and declining to move forward with the transition. And you will have had a transition planning conference, so you should receive that Teis record importing to Easy IEP after the transition meeting. This information can be uploaded to that child's record before exiting and using that transfer to regular education. And as far as indicator 12, again, we've said there is that parent refusal or parent reason category. As long as all of this is taken care of prior to the child's 3rd birthday, that is the category that the child would be reported in for indicator 12. Okay, next slide. We've got another scenario, and in this one, we attended a transition planning conference with the Smith family about 4 months before Alex's 3rd birthday and made a plan to meet in about 1 month to get the parental consent signed and begin the evaluation process. The family was unable to attend that first scheduled meeting. We have tried to call the parent 4 times to reconnect and schedule a meeting with no response. What should we do next? And we've got a poll that we're going to launch for this one. And so hopefully that will open up easily for us. And if you'll respond to this, which of these actions should the LEA take? A, attempt other forms of contact and keep a detailed contact log. B, maintain documentation such as meeting invitations or appointment letters. C, use a prior written notice to explain why an evaluation will not be conducted. D, send a prior written notice and the notice of procedural safeguards to the parent. Or E, all of the above. And we'll give you a few more seconds to respond to that. We can see quite a few responses are coming in. Let's see, we've got 70% of you have responded. I don't know if we want to take just a couple more seconds, and then Sherry, if you want to end that poll, we're almost at 75% of
Okay.
responses. Okay. Yeah, if you want to, whoop. I don't know if it's sharing the results with everybody. On my screen, it seems to be fluctuating, but the overwhelming response was E, all of the above. And I think you got our hint that that would be correct to do all of those actions. So really kind of following the order that it was listed there. The very first thing is to attempt some other form of contact. If phone calls are not being successful in reaching that parent, you may want to try email, sending a letter. Sometimes that might even be getting in contact with TEIS, finding out if they have a different phone number, or verify that the information you have is correct. See if they have some other more successful way of contacting that family. Once again, maintaining documentation. So any invitations to meeting that have been sent, any appointment letters, as well as other documentation that you've been acquiring. It would be a best practice, once again, to use a prior written notice to explain why an evaluation is not going to be provided in this situation. Include those details of the missed meeting that had been set up with the family, as well as those attempts at contacting the parent and that were not successful at this point. And then again, to use certified mail to send that prior written notice, as well as an additional copy of the notice of procedural safeguards, and maintain all of that documentation to finish up this transition. All right, next scenario is a transition planning conference that is held from 6 to 9 months before a child's 3rd birthday. Is it okay to delay an initial evaluation so that assessment data will be collected closer to the child's 3rd birthday? So we're going to do this again in a poll format, and you're just responding yes or no for this poll. Okay. We're at, let's see, 65% of you have responded. We'll give a few more seconds to answer to that poll, yes or no. If you're having any trouble using the polls, you could always put that in the chat. But Sherry, we're at 80% of respondents now. So if you want to share those results.
Okay.
Okay, we had 72% of you said yes, and 28% said no. Okay, let's go ahead and talk about this. It is, it may feel a little bit of a tricky question, okay, but the correct answer is yes, you can wait. But what you want to make sure of is that you are meeting those timelines that are in place to conduct that initial evaluation and determine eligibility, as well as meeting that IEP timeline and having that developed by the child's 3rd birthday if they are found eligible. I should point out that a transition meeting that is held 6 to 9 months before a child's 3rd birthday is within the window of a timely transition planning conference. That may not be the typical timing, but you may see that at certain times. Sometimes the situation may be with a child who has some very complex needs. And so allowing that amount of time for transition is giving everybody that time for transition planning. Other times I know I've seen it where a child's 3rd birthday is right at the start of the school year. That's where you may kind of back everything up well ahead of that, again, so you have enough time to complete that transition. You just really do want to ensure that you are considering any benefits and disadvantages of waiting to begin the process to conduct the evaluations. So looking at this timing, making sure you still have your eyes on where that third birthday occurs, because you're continuing to have transition meetings, you're continuing to receive late referrals or child find referrals that you're also completing, and not letting a transition such as this kind of fall off the radar. Okay. All right, we can go on to the next scenario. And this time the LEA has received notice of a child with a summer third birthday. May the LEA delay special education services for an eligible child until school resumes in the fall. This one is going to be done as a poll, once again, with the yes or no options. And we will provide a little context because I know this may feel a little bit tricky to answer as well. But we've got answers coming in. So may the LEA delay special education services for an eligible child until school resumes in the fall, and the child has that summer birthday. Let's see, we're close to 80% of respondents. Yeah, we hit 80%, so if you want to end that, Sherry, and share those results. So it does look like this was a little bit of a tricky question of how to answer it. We had 58% saying yes and 42% saying no. So the simple answer to this is no, that you cannot just immediately say services are not available. Our schools are closed in the summer. So you cannot say no simply due to school not being in session, or with this being an initial eligibility of a child, saying that you lack that data to show the child has any regression. What you do need to do is make an individualized decision. Okay, and this would be by the IEP team, not the transition team at that transition meeting. But that IEP team should consider any services that are needed to address the child's disability and their degree of impairment. And so if the child is turning 3 over the summer, again, it's that IEP team that would determine if the child qualifies for extended school year services, as well as looking at that individual child if any other services are required to provide a FAPE for that individual child. All right, we're going to go to the next scenario. And in this time, when we get you to interact in just a moment, we're going to be using the chat. So you may want to locate where that is if you haven't been using that yet. You can be looking in the toolbar area at the bottom of your screen. So in this scenario, there was a transition planning conference held for Ben on September 18th, 2021. His third birthday is January 1st, 2022, which is during a time that school is not in session. His evaluations were completed and the team met on December 10th, 2021 and determined that Ben is eligible for special education services. An IEP was developed and signed by the team on that same day. And the team determined that Ben's IEP services will begin immediately when school resumes after winter break on January 10th, 2022. So again, we're going to ask you to use the chat to respond for these different events that can sometimes be confusing. So based on the scenario, what date should be used for each of these events? The eligibility date would have what date populated? Okay, and I'm seeing several responses, and so far I'm seeing every one of those correct. This one is fairly straightforward, and it is December 10th, 2021. That would be used as the eligibility date. Okay, we are going to go to the next event. So how about the IEP event date? Meaning the IEP meeting. And this is what will show up in the child's history in Easy IEP as an IEP event. Okay, again, I'm seeing a lot of responses. I saw same, I'm seeing a lot of December 10, 2021. Right, and Sherry, if you want to go ahead and pop that in, that also is correct. This one again is fairly straightforward, but that IEP event is the date of the meeting. So it is December 10, 2021, or the same as that eligibility date. All right, this one may be a little more of a challenge. What is the IEP begin date? And I'm seeing some of you responding a little bit ahead of me saying it. And this time I'm seeing some variation. So let's give you just another couple of seconds. Okay, I'm seeing quite a few that are correct, but I'm also seeing a little bit of fluctuation. But Sherry, go ahead and populate the IEP begin date. And I did see someone type in 3rd birthday, and that is the date that will be used as the IEP begin date. So for Ben in this scenario, it is January 1st, 2022. But that 3rd birthday is when he can be served under IDEA Part B. Okay, so again, this may be tricky. What will you use as the end date on his initial IEP? And I'm starting to see some responses. I know I saw it scroll across. I did see a correct response, and I'm starting to see quite a few variations. We'll give you just another few seconds to think that through. Okay. One I happened to see that was correct, and I saw the name attached to it. Mary Margaret, you got it. Okay, the end date is 12/9/2022. You are going to use 365 days from when that eligibility was determined and they sat down to develop that IEP. So for this child's initial IEP, it may not reflect a full 365 days on the IEP document. Okay, and the correct end date would be 12/9/22. And so then the last one, the services begin date. So this is on the services page of his IEP. What will be used to show the services begin date? And I'm seeing quite a few correct responses coming in for this particular scenario. Okay, I think I've seen every one of you correct so far. So Sherry, go ahead and pop that in. January 10th, 2022 is when Ben will actually start attending and start receiving his services. So that is correct. Use the begin date of when he will begin to attend. I do want to point out that there is a document in Easy IEP on the early childhood tab. I believe it's called Guidance Early Childhood Event Date, something to that effect. And it includes this information. So as you or your teams are having questions about this, you may refer to that document to describe similar information as to what we had on the screen. Okay. All right, we'll move on to the next scenario. And this one will kind of be within the poll itself. When TEIS or the parent provides the LEA with current and appropriate evaluation data for a child, what should the LEA not do? So pay attention to that underlined, italicized not. I'm not sure if it will look that way in the poll when it launches, but what should the LEA not do? A, incorporate the evaluation data into LEA evaluation information. B, evaluate for all areas of suspected disability. C, determine the child eligible upon receiving the TEIS and parent provided data. D, review information from a variety of sources. Okay, so you're answering what should the LEA not do? And this, I see some of you using the chat. You can respond in the poll to this one. And we'll give you a few more moments to read back through that, but respond for what the LEA should not do in this scenario. And we're at about 65% of you responding, now up to 70. So we'll take just a couple more seconds. This had a little bit more to read through in some of those responses for what the LEA should not do. Okay, I think the responses have slowed down. Oh, there we've got a couple more. So go ahead and share those results. Okay, and so the overwhelming was that they should not determine the child eligible upon receiving information from just TEIS and or the parent. Okay, and that is correct. So what you should be doing upon receiving that information is to incorporate that evaluation information along with any other assessments and tools that the LEA will be using. Of course, as always, with an initial referral, you need to evaluate for all areas of suspected disability. So you may be reviewing that information and then again, incorporating it along with any other assessments that the LEA needs to provide. And then reviewing all of that information. So again, any eligibility determination needs to be based on information from a variety of sources and should not rely on any one assessment or tool. All right, we're going to go on to the next scenario. And in this one, Taylor's parents missed the first scheduled date for an eligibility meeting with our LEA. We scheduled a second meeting at a time convenient for the parents, but they still did not attend. Taylor's third birthday is quickly approaching. So in this situation, can the LEA convene an IEP meeting to determine eligibility without the parents' participation? We're going to do this in a poll as well. And it is posed as a yes or no. We will provide some further context in a moment, but go ahead and respond. In this situation where the parents have missed the eligibility meeting and another opportunity has been offered that was missed, can the LEA convene an IEP meeting to determine eligibility without the parents' participation? Okay, we're approaching 70%. We'll give you just a couple more seconds to weigh that one out. Okay, and we're almost 80% now. So Sherry, maybe we can show those results. Okay, and we're almost evenly split, 48% saying yes and 52% saying no. And so we have, again, what is the simple answer is yes, if and when several things are taken care of. So the very first being an emphasis on ensuring that the parent has had multiple opportunities to meaningfully participate. So that is meaning that they have been invited to that eligibility meeting. They have agreed to the timing and that schedule that was offered in that eligibility meeting. You have sent invitations to that meeting. And this has happened multiple times that they have been offered a time that they could participate and then they didn't follow through. Once again, as we've said many times, maintain that contact log with each contact attempt and the outcome or result of that attempt. So this would include that you have set up those meetings, you have sent reminders. Oh, if we can go back, and that contact after a missed meeting. Make sure you're logging every one of those pieces of information, whether that's by phone call, email. Certified letter is a way to guarantee the information gets to the parent. Some LEAs will even take those steps to make a home or a work visit. Document, 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 as Dolly said a few moments ago. Only after all of those efforts would you convene the IEP team to determine eligibility upon review of all of the information data. And again, we're going to provide a little more context and try to address other concerns or questions that you have about this. So now if we can go to that next slide and look through kind of two different scenarios within this setting. So some of the times the child does not meet the standards to be identified as a student with a disability. Okay, so you have all of the assessment information, and what you will do, again, if this is after multiple attempts to include the parent, the IEP team then can sit down to determine eligibility. In this instance, you're creating that eligibility report indicating that the child is not eligible. They do not meet the criteria. This time, it is essential and crucial to have a very detailed prior written notice. This should list all of the reasons that the team is finding the child not eligible, including the data sources that were used to come to that decision. You want to have the details of those attempts to have the parent participate and have the parent meet with you. So including the dates and the results of those meetings, as well as the contact attempts that have not been responded to. And then also including how and when the information will be explained to the parent. And that might be in that next bullet of using certified mail, once again, would be the best practice. And you would provide copies of that eligibility report and that detailed prior written notice, as well as an additional copy of the notice of procedural safeguards to the parent. And the LEA will stop at that point. You are not going to move on, and you would not be able to provide any special education or related services that would require parental consent to begin providing any services. Okay, other times the child does meet the eligibility standards to be identified as a student with a disability. Again, we're discussing where there have been multiple offers and opportunities to try to meet with the parent, and you have not been able to get that follow through. In this case, the IEP team would sit down to determine eligibility. You would create the eligibility report indicating that the parent is declining services. Once again, the prior written notice needs to be very detailed. It should include information for the sources of data that were used to show how the child meets the eligibility standards. You should include the dates and other information about the attempts to include the parent in this process, as well as how and when the information will be explained to the parent. Once again, that is probably going to be by providing those copies of the eligibility report, the prior written notice, and an additional copy of the notice of procedural safeguards to the parent, and sending that by certified mail so that you can ensure that it was received by that parent. And as we said a moment ago, the IEP team, they may make that eligibility determination without parental consent, but the LEA may not begin the initial provision of special education and services without the parent's consent. This information was provided earlier this school year in one of those special education, special populations meetings with supervisors. And it was provided by the Director of School Psychology Services. And so you may have seen this information. It was a couple months ago where it laid out this information. All right, and I know I saw the chat very active at that point, so I
It's
don't
about
know.
attendance. Some of them did not receive email verification. Not sure why that's not going there. Some have, some haven't. So I will check on that, but just know that we have this recorded and we have a log of all of you that have attended. So all of you that are logged on with us today, you are good. So don't worry about that attendance piece. We have you.
Okay, so I think we're going on to Sherry.
Yes.
We have shared a lot of information with you today. And so now we are going to hear the positive things that you are doing in your district. So as we have discussed all the compliance issues and requirements for easy transition, let's think about what is successful in your school district. What are some ways that you help to ensure a successful preschool transition for children with disabilities and their families? If you could just write your few ideas down in the chat, Dolly and Colleen will share those.
We had streamlined point of contact, visiting the classroom.
Good.
Transition planning conferences held in the family's home to
All
make the
right.
family more comfortable. Providing a tour of the school.
Pre-K assessment teams solely for transitioning babies.
All right.
Providing a
Providing-
first backpack.
I
That's,
love that one.
yeah.
Too. Oh, that's
Repeat that again.
Providing
Go ahead, Colleen, I'm sorry.
providing a first backpack for a child.
Oh, isn't that wonderful? Okay. These are marvelous ways to help you moving forward. And we do hope this information has been beneficial. Let's move on. We want you to know that all of the information that we've shared will be available in the resources section of the EC SPED webpage. And we also have on that page other Indicator 12 resources. We will shortly have the FAQ, and I think that everything that has been addressed today will be in a question answer form on that FAQ. It's going to be very helpful for you. We also have information on ECTA, the Indicator 12 EC transition webinar, that short webinar that was required by June 30. And also we have new information from ONLAR, who is our Tennessee Technical Assistance Network that supports our learning.
okay. Thank you all. And thank you all for being here. Here are your contacts for your APR support program. We want you to know that we are your team. We are here to help you with any questions you have, direct support, resources, anything that you may need. We are focused on early childhood indicators, and then are developing resources for those compliance indicators as well, 4, 9, 10, and 11 in addition to these. And we are working on those resources now and developing that support program for you. So here's your contacts. Again, Colleen is your East Tennessee rep, Dolly is your Middle Tennessee, and Sherry Walker is your West Tennessee. And we are here to support you. The map that you see below will be linked. It is already on our early childhood special education webpage. So if you wanted to view that map, you can go right now at the end of this, and you can go to the early childhood webpage and scroll down below our contact information, and you will see the link that takes you to the map that then supports which district is aligned with which of your consultants for those contacts. So we would love to have your feedback today. Please toggle over the QR code or use the link that you see here in another browser to just provide just a couple of quick questions so that we know how we are supporting you, how we can develop this further. We want to reach all that we can in support of these answers to the questions that you are having in this area. So we appreciate that. And our next slide offers also the fraud, waste, and abuse. Here is the phone number and the hotline and webpage for you to submit any fraud, waste, or abuse reports that you may have or come across. And we just want to thank you for being here. We have a few moments we can give you back, or you can stay for just a few minutes if you'd like. We will stop our recording now, but I thank you all for being here.
Sherry, you may, I'm sorry.
Answer those questions. Oh, that's okay. Go ahead, Dolly. What were you going to
I
say?
just said Sherry may want to go back and show the QR code again, just as we're closing out,
Okay.
in case people
Okay.
didn't see it.
And
If
Sherry, you can
do
go
that.
ahead and stop the recording as well.
There you go.
So yes, so there's the QR code. If you all would take just a moment to please do that, or open it in a browser to do, after